Hello everyone. Sometimes it is difficult to differentiate between atrial flutter and sinus tachycardia. So you're working in the ED and somebody hands you over this EKG to read. You look at it, you notice that it's a regular rhythm. The patient appears to be tachycardic. You see that there are P waves before each QRS complex. So you read it as sinus tachycardia. You go see the patient, you find the patient to be well appearing. He appears to be tachycardic on the monitor around 128, 129 per minute. He was having a little bit of funny sensation over his chest. His lab results were essentially unremarkable. His D-dimer was negative. He wasn't in any pain. He did not appear to be anxious. And despite receiving a bolus of IV fluids, his heart rate really didn't go down. You might be tempted to perhaps discharge the patient because you haven't really identified anything abnormal that would explain his tachycardia. But you're bothered that this is sinus tachycardia and you haven't really found a reason for it. And you ask yourself, what am I missing here? You look at the EKG and you see that there are P waves before each QRS complex. You also notice that the EKG overall appears to have a sawtooth-like pattern to it. So you're thinking, could this be atrial flutter? Sometimes it is difficult to differentiate between atrial flutter and sinus tachycardia. The sawtooth-like pattern that we are typically used to in atrial flutter is usually easily identified when you have a 3-to-1 or a 4-to-1 conduction. But when you have a 2-to-1 conduction, that can become a little bit challenging. You can easily fall into a trap calling this sinus tachycardia. In such patients, always ask yourself, could I be missing atrial flutter? I'll give you 3 tips that can help you make that distinction. Number 1, go look at the monitor. Patients who are in atrial flutter usually have a heart rate that is maintained at a certain number. This patient had a heart rate about 128 per minute. Maybe it went down to 127, went back up to 129, but it had a very narrow range of fluctuation. As opposed to patients who are in sinus tachycardia, their heart rate usually fluctuates a little bit more than that, and it changes with activity. When you sit them up in the bed, when you walk them in the emergency department, and so on. So patients who are in atrial flutter always appears as though their heart rate is stuck at a certain number. Tip number 2, speed up the EKG machine. When we normally get EKGs, the speed at which the EKG paper runs through the machine is 25 millimeters per second. And that's our standard. But if you speed up the machine to 50 millimeters per second by changing the settings on the device, on the machine itself, what will happen is that the EKG tracing is going to move faster, and the tracing itself that's going to be printed on the paper is going to be stretched out. And this will allow you to look at what happens behind that P wave that you were able to see on the original EKG. This is exactly what we did with this patient. We reran the EKG at 50 millimeters per second, and this is what we were able to see. If you look closely, you can identify a very small bump that precedes every P wave, cluing us in that this is actually atrial flutter with a 2-to-1 conduction rather than sinus tachycardia. Tip number 3, calculate the atrial rate and try and establish a correlation between it and the ventricular rate and see if it clinically matches what you're seeing on the monitor. To calculate the atrial rate, you count how many P waves you're able to see over the course of 6 seconds on the EKG and multiply that number by 10. If we go back to our original EKG at 25 millimeters per second, you will notice that at the very bottom, there are 2 red marks. The duration between these 2 red marks is a period of 3 seconds. The duration between 3 red marks is 6 seconds. And if we count the number of P waves over the period of 6 seconds, you will see that they are 13. Now, because we already know in advance that there is another P wave that precedes the P wave that you're able to see on the EKG, multiply that number by 2, that gives you 26. Times 10, that's 260 beats per minute. This is your atrial rate. In a 2-to-1 AV conduction, you divide 260 by 2 gives you a ventricular rate of 130 beats per minute, which exactly matches the ventricular rate of the patient clinically as well. So the bottom line is, when in doubt and confused whether you have sinus tachycardia versus atrial flutter, remember to go look at the monitor, run the EKG at 50 millimeters per second, and calculate the atrial rate and establish a correlation between it and the ventricular rate to figure out if this matches the AV block under consideration. I'll see you next episode.